Hi, this is Josh, Dream Body Clinic. Today, talking a bit more about Muse Cells. So Muse Cells are new for us treatment, but they've been around since 2010. They're a true pluripotent stem cell found within mesenchymal stem cells. Really cool, they turn into the cell type that you need. Now, we've done studies on a lot of things. They've done them for heart health, they've done them for brain health, for a lot of organs, and even herniated discs, but they haven't done much, if any, on joints. So traditionally, and what we've been doing for over 8 years, is using mesenchymal stem cells, and we'll inject them directly to a joint. Like last week, I did my shoulders with mesenchymal stem cells. We had some extra cells, I'm not going to waste them. Happens every once in a while, someone can't do treatment, and well, I'm going to use them. Well, my wife, she has been having a lot of shoulder pain. She may be sleeping on her shoulder wrong. Who knows how it happened? So we have the Muse cells now. We're like, well, let's try them. And we injected into her shoulder. And so far, I haven't really seen much success. And that it's kind of a good thing in the sense that Muse cells have never been promoted, published, no studies on joints. But theoretically, at least from what Dr. Dezawa, she's a professor from Japan that discovered these, has in videos that you'll see on our page. We flew her to the clinic a few weeks ago, interviewed her, did a bunch of videos. She did a presentation we filmed. And there's clips from that where she's found consistently the IV treatment of Muse cells has been the most effective. But we wanted to see, we've got them, let's try them out. So far, nothing. They are supposed to work faster, but it does seem, at least so far, that probably an IV will be best. And we're not even offering them for joints at this point, but we want to let you know we are trying things out. We will be trying them in the future. I know we're going to treat people that have joint problems already and are going to decide to do the Muse cells, and we'll be able to see if it works that way. So as of now, we're not focused on joint treatments with Muse cells. If you go to the website, www.dbcmusecells.com, you'll see it's for the only joint we're doing are herniated discs. We're doing heart health, we're doing pancreas health, we're doing liver, kidneys, brain, those sort of treatments. And I did 20 million yesterday via IV. My daughter did 20 million yesterday for a herniated disc. So we'll get you some data on that. We had another patient do 20 million yesterday. So we're getting more patients trying it, get you more data. These are new, these are experimental. We're letting people know, tried and true, if you want to fix your shoulder, mesenchymal stem cells are still the way to go. It's worked incredibly well for labral tears, for supraspinatus tears, for rotator cuff issues, for cartilage issues like arthritis. The mesenchymal stem cells work. Now, the difference is MSCs create the healing environment via the paracrine effect, sending out signals, guiding it. They're like the manager. Where Muse cells are a true stem cell. They're supposed to go in, eat up bad, damaged tissue, and then differentiate into it. So the IV, it sounds too good to be true, but you might just need an IV of Muse cells to fix just about anything, because they can turn into any cell type, any cell from any of the 3 germ layers, which basically means any cell possible in your body. But the studies are ongoing. We're just now rolling these out. So again, experimental, but if you would like to try them, they're super safe. They're non-tumorigenic, so no cancer risk. They lack HLA, or they don't lack it, but they don't exhibit it, just like MSCs, so that your immune system doesn't detect them. And the worst case scenario we've seen so far is you get a little headache. I didn't get a headache, but my daughter and our head doctor both got a headache from them. Now, a headache for a herniated disc, well, I'll take the headache if it's just a day or two. So pretty simple. If you want to learn more, go to www.dbcmusecells.com. I'm Josh, happy to help.